yet another podcast with Kaho and BW Healthcare World. My name is Harbinder Narula, and today we shall talk about the role of rehabilitation in healthcare outcomes. My guest today is Dr. Saril V.S., who is the Assistant General Manager for Quality and Business Developments at Sakra World Hospital, Bangalore, which is a joint venture with CCOM and Toyota Susho Japan. He's also the chairperson of Kaho's Rehabilitation Quality Forum, which is the first of its kind devoted to enhancing the quality of rehabilitation services across the globe. Let's talk to Dr. Saril on the fundamentals of physical medicine and rehabilitation and the role it is playing in modern medicine today. Welcome, Dr. Saril, to BW Healthcare World.
Thank you. Namaste all. Let's understand the deeper concepts of rehabilitation. It's a very good question to begin the note. Uh, in terms of healthcare outcomes, rehabilitation refers to the process of, helping patients or anybody for that matter who has got an injury, illness, or a disease to regain their physical, cognitive, and functional abilities. So the primary goal of rehabilitation is to improve overall quality of life, make somebody independent, and overall well-being. There are a lot of advantages. I mean, the people who are the beneficiaries would actually vouch for it. The improved functional ability, which is like rehabilitation helps people regain lost skills. Skills, I mean the daily life skills. It can be as simple as just holding a cup of coffee in the morning, or just able to understand where is the cup of coffee for that matter. So it also helps in pain management, enhanced mobility, increased independence, as I said. So nobody like to be dependent on anyone for that matter, right? So when you are weak, when you are sick, when you are unwell, you tend to be dependent on people. But rehabilitation on the whole helps people to reduce the independence and make them to be self-reliant and self-sufficient for daily tasks, self-care activities, I mean. Better mental health is a greater advantage. So there is a huge aspect of rehabilitation, which is around emotional and psychological well-being, reduced hospital readmission. So if you have an effective rehabilitation, for example, if you're taking it for a really long time as prescribed, you can actually reduce the need for readmission. So the complications or the likelihood of complications kind of start reducing down. Rehabilitation promotes overall healthy lifestyle. So there's a lot of wellness now. From illness, we are moving to the wellness, actually. So therefore, rehabilitation helps people to really lead a healthy lifestyle, to avoid or prevent any kind of disruptive diseases which can happen. Now there can be some kind of disadvantages. I would not say disadvantages per se, can be some challenges overall. It can be time consuming. So rehabilitation requires ongoing commitment and time. It is not done on a day or two like that. So people need to be very patient. Both the care provider, formal, informal care providers, and the receivers need to be very patient with the process. It can become a little frustrating, but it's worth at the end of the day. Though which can pose a lot of emotional challenges. Actually, even the patients may, face frustration, sometimes anxiety, depression in the long course of time. Uh, the major problem across the globe is the limited accessibility. So rehabilitation services may not be readily available, or sometimes it may not be affordable. When I say affordable, the major issue in a developing country like India is the insurance coverage limitations for rehabilitation. And also rehabilitation may need an ongoing maintenance on the long run. Now, when I'm seeing a lot of such limitations, please understand that rehabilitation is a crucial aspect of healthcare in modern healthcare. It focuses on restoring a patient's or a person's quality of life and functional abilities. So while it presents some of these challenges, the benefits of rehabilitation far outweigh the disadvantages. So leading to an improved health outcomes and increased independence, as I would like to put it.
Awesome. And Dr. Saril, how old or how new is this concept of rehabilitation in healthcare in India as a conscious effort? How old or new is this concept in India?
Well, the concept is not new, but it is evolving. I would say it's emerging over a period of time to a more matured, structured healthcare delivery system. In fact, rehabilitation has been an essential part of universal health coverage, aiming to promote healthy lives and well-beings of all ages. Rehabilitation in India has evolved over the years. With there are a lot of organizations and healthcare providers now offering something called as specialized rehabilitation services. Now, today, rehabilitation is recognized as a crucial aspect of healthcare in India, thanks to the kind of effort that many people have put in, and the understanding that people have got, especially the referral authorities, I would say, because it all starts from that. If the authorities do not understand when to refer, what's the right time to refer, and what kind of patients to refer, then the whole point is probably lost. But nowadays, we are seeing something called early intervention. So, which means that we are getting the right timely referrals to intervene at an early intervention, and therefore we are getting better results. So, the concept is forever changing like anything else in the world, but I must say it's gaining a lot of understanding from the public as well as all the stakeholders of late, and it's gaining popularity, which is definitely a very promising move. Yeah.
And Dr. Saril, why is rehabilitation? Because, if I understand from what you just said, rehabilitation has always existed. It's a part of the recovery process. But now it is getting more organized, and, people are taking understanding the importance of it.
Yeah.
Why is rehabilitation important, and how does it alter the healthcare outcome and affect the patient recovery? Because if you are able to explain this, it will help our audience understand why they need to take this as a part of the treatment process itself.
Yeah. Yeah. Um, as I said, rehabilitation is definitely an essential part in healthcare as it significantly impacts a patient's recovery, the journey of recovery, quality of life, and overall healthcare outcomes. So when somebody goes, let me put it in a very simple way. If you get any disease, you get admitted, you go to a hospital, you get admitted, and the day you discharge, are you able to return to the office the very next day? Forget that. Are you able to even make a cup of tea for yourself? So that's the $1 million question over here. Are you ready for life? That's where the significance of rehabilitation come into picture. It enhances mobility, which is a very basic essential aspect to move from one room to the other room, and overall it reduces the disability can be in various formats, but overall, if the disability can be reduced, the person's productivity becomes much more. The engagement in society, the engagement in daily care activity gets better. So you are no more a burden to yourself, you're no more a burden to the society or even your family for that matter. So we can manage chronic conditions. There are a lot of people who live suffer because of chronic conditions, and it can also prevent complications which happens over the way. As I already said, the mental well-being is a huge aspect which the rehabilitation can play a vital role, and also enhances the patient satisfaction because you want to return to life as soon as possible. You don't want to be depend on people and then not able to do very trivial things in life that you always enjoyed, like say lifting your child or grandchild. It gives you an immense pleasure and joy and engagement in life. But imagine you have a frozen shoulder and you are not able to lift a child from the floor. You really, it just affects your entire being. So that's the essence of rehabilitation. So incorporating rehabilitation into healthcare, I think patients can experience a lot of improved outcomes and enhanced quality of life, to mention. Yeah.
I couldn't agree more with you on this, Dr. Saril. Dr. Saril, let's understand from the service provider's perspective. What
Yeah.
is the outcome of rehabilitation as expected from the point of view of the service provider?
Well, there are service providers can be of various types actually. Like there are different settings in the world. Like, for example, it can be from a government setting, it can be a private corporate setting, it can be NGO. There are different service providers for that matter, can be even a clinic for that matter. Now, irrespective of the type of service provider, uh, they would expect, ideally, they would expect a comprehensive assessment is essential and a goal setting. We have to do something called as individualized treatment plan. So what happens is, every person is unique, every person's requirements are unique. Therefore, one person's treatment plan may not fit another person. Therefore, there's a huge requirement for individualizing or customizing the treatment plan. We call it as ITP. We'll have to definitely use a lot of evidence-based interventions. That's how we standardize this entire process of giving the service delivery to everybody in a uniform manner. Regular process of progress monitoring, and we'll have to tweak in a little bit of treatments here and there. We cannot just do this. Sometimes the patients get accommodated to the therapy, but unfortunately there are some centers which would just continue doing the same thing because there may not be a regulatory authority to review that. So you will have to develop your own kind of systems in place. You need to have a collaboration with interdisciplinary teams. Rehab involves a lot of different disciplines which comes together. It's never done by a one single profession. And therefore, a continuous quality improvement is a mandate when it comes to delivering rehabilitation, and especially in terms of outcome of rehabilitation. It has to be measured. This is one of the reasons by which insurance companies are still shying away from venturing into offering, or absorbing rehabilitation as part of it. Some companies are, there is a happy change happening of late. So a lot of centers are now taking the quality way, the continuous quality improvement, where you measure the progress and you are able to quantify and tell that my patient on the day one, this was the presentation, and day 10, of 1 month, 2 month, the patient is really progressing in terms of XYZ parameters actually. So these are some of the outcome that I think, irrespective of the service provider, everybody needs to, or it is expected. It's a basic, basically.
And you brought in the word that it needs to be measured. I think that is extremely important, Dr. Saril, because because it's a very subjective thing that I'm feeling better or are you feeling better. So are there any markers of or quality improvement quotients that are usually used to measure the outcomes of rehabilitation?
Oh, there are plenty of them. And as I said, these are getting popular world over. Um, some of the examples, and they can be a little technical, but I'll try to sum it up and give a few examples. Something called functional independence measure, or FIM, Barthel index. Then there is something called patient reported outcome measurement information system. As I said, health related quality of life need to be measured. So there is something called SF36, or short form 36. Now, these are some of the technical, and it can be very specific to each profession or the professional. Now, there are quality improvement quotients like the length of stay of the patient, readmission rates, complication rates that happens in different types of patients, patient satisfaction scores, or discharge destination is a very good outcome measure. Like, are they discharged to go home, or are they again going to another nursing home, or return to work? How many of people are able to return to work after a particular disease, or return to school for that matter? How many children are able to return to school? So there are even quality of life metrics like for pain, depression, etc. Actually, yeah. So there are a lot of quality outcome measurements which can really define the patient progress, and also helps the informed decision making for the service providers. That I'll have to change a particular the treatment line from A to B, or a plan this doesn't work out, we need to probably go ahead. So it's a collaborative decision at the end of the day. But if you are measuring the patient outcome, both the family and the patient, as well as the care providers, can make a much more well-informed decision making. Yeah.
No, this is really nice what you brought out, but also, uh, what I understood from you when you were answering one of your earlier questions, that it has always existed. The concept of rehabilitation, but it has evolved to be much more professional today. Now, when you look at from the patient perspective is the one thing, but when you look at from the professional side, what are the opportunities in the field of rehabilitation?
Yeah. Uh, as I said, when we say rehab professional, it is a varied, it's a big spectrum. Uh, but a good change which is happening over a period of time is that we are all, kind of shaking hands and coming together to give more comprehensive rehabilitation, which is specialty based. So I can give a few examples like neuro rehabilitation, pediatric rehabilitation, geriatric rehabilitation on the other spectrum, sports rehabilitation, cardiac rehab, pulmonary rehabilitation, pain management itself is an emerged sector, amputee rehab, spinal cord injury rehabilitation. There are plenty of disease specific or a condition specific rehabilitation, which is really the need of the hour. Now, how do we deliver this? There can be various settings. As I said, like it can be through hospitals, dedicated rehabilitation centers. It can be even a smaller clinic that is function in the suburbs, or it can be a skilled nursing facility or SNF. It can be a home healthcare, which is a great emerging business field as of now. It's booming all over. It's called home healthcare, and also community-based programs. Also, all this is possible because of some emerging, I would say, futuristic trends, which is like telehealth and virtual rehabilitation. Thanks to the COVID era, we are able to connect with anybody anywhere in the world and without having the need for physical kind of touch or something. But it has its own plus and minus. Having said, the accessibility has improved. So there's a lot of assistive technology and robotics which is taking the center stage of late, which is also a welcoming change. There is integrative and complementary therapies. I could take pride in saying, being an Indian, yoga therapy is also becoming a very integral part of this entire healthcare delivery system. So we can take a lot of complementary therapies as part of an integrated approach. And last but not the least, it's like the healthcare promotion and wellness is the futuristic approach. So all this is helping professionals to really take various kind of areas to specialize themselves and channelize all their energies and effort to deliver something which is the most relevant to the society.
Dr. Saril, this is really important because when you talk about the integration of various therapies, as well as talking about creating awareness for
Yeah.
the concept of rehabilitation, you require forums to come forward or industry bodies to come forward, right? So, what are the forums that are presently active in the field of rehabilitation for the new generation to interact and gain further insights about
Mm.
its field and its related activities so that the true integration can really happen?
There are a lot of forums which is existing, which is more of the professionals coming together. So I would say professional associations across the globe. To name a few, WCPT, which is World Confederation of Physical Therapy, WFOT, which is World Federation of Occupational Therapists, ASHA, which is American Speech and Language Hearing Association, NARC, National Association of Rehabilitation Counselors. RESNA is a very important organization which is like Rehabilitation Engineering and Assistive Technology of Society of North America. So, however, there are absolutely no global forums for integrated multidisciplinary professionals. What happens is each forum is catering to a particular profession and their requirements. So, therefore, we have created something called CAHO, Global Rehab Quality Forum, CAHO Global Rehab Quality Forum, which is a common platform for all the rehabilitation professionals to focus on quality improvement and patient safety across the globe. The vision itself says it all. It's very, very important that we all join hands together. That's the need of the hour, because patient does not probably differentiate from one particular professional to another professional. for them it is one service and they need to get better. So it's the need of the hour that we all come together and we focus on improving the quality and most importantly patient safety, because let's not do any harm while doing what is intended to do for the patient. So that is why there is this very important, very significant forum which is come across the globe, and we are now in the process of the getting as many number of professionals together to really work, join forces and really work towards this greater vision that we have.
Dr. Saril, this conversation has been really, really useful. I think this concept of rehabilitation is a game changer. While it has existed for, I think, since the time healthcare has come into being, but I think the way it is getting recognized today by the industry and subsequently by the patients itself, I think it is going to be doing wonders. What I could gather was that the first aspect that needs to be addressed is recognizing the need for referrals so that there is early intervention that happens and the outcomes are impacted in a positive manner.
Yeah.
Second thing is, I think, you also brought out a very important aspect that the insurance needs to recognize this as a part of the treatment protocol because, the treatment process is a journey of recovery, which, that was a word, that was a phrase that I caught on to when you spoke about. And then you very beautifully brought out that rehabilitations reduces disability, which in turn increases your production and getting back to what your normal life is. And for that to happen, I think uh, measurement needs to be brought in because, and today I think, we have the technology advancement that is happening where measurement is easy and is possible so that you could see. Because, I remember going to a rehabilitation center where you were expected to put in the pressure. You had to squeeze your hand and put in the pressure. Now, when you ask someone, क्या pressure लगा रहे हो? It's a very subjective thing. I mean, I could be putting the pressure, but the other person does not know
Yes.
whether it's a reality or
Yes.
not.
Yeah.
But today, technology has got advanced to a point where we are able to measure how much of pressure so that there's a standardization. But the last bit that you brought up was, I think, the most important aspect that we have an opportunity, especially in India, to integrate various therapies that we have. So when a patient leaves the hospital, it does not mean that the treatment has finished. The, the treatment in terms of protocol may have been done, but there's a process of recovery which needs to be done at home. And there could be physiotherapy, there could be yoga, there could be mental aspect to it. And so the opportunity that exists today, I think, what you really brought out was in the concept of integrated services,
Yeah.
for which I think, Kao has taken a beautiful step by creating this, the group or a forum to address the need that is there, but is not recognized formally. So I think that's a beautiful thing that Kaho is doing. Dr. Salil, thank you so much for taking out time today. I know you
Thank
are
you.
unwell,
Thanks a
but still
lot.
you took out time. It means a lot.
Thank you. Thanks a lot for the opportunity.
Thank you so much, sir.
Thank you.